Hello, and welcome to Dental Health Matters, brought to you by the BSDHT. Today, we're exploring how dental professionals can empower patients through clearer communication, better understanding, and stronger trust. Health literacy plays a vital role in helping patients feel confident about their oral health and treatment choices, and it's something dental hygienists and dental therapists influence every day in practice. I'm Rhiannon Jones, President of the BSDHT, and today I'm joined by Kat Edney, a multi-award-winning dental therapist, international speaker, and founder of The Modern Therapist. Together, we'll share practical insights to help patients better understand their oral health and care options. So, Kat, thank you for joining us.
Oh, you're so welcome.
Oh, it's lovely to have you. So I'm thinking, for listeners who may not know about your background, could you briefly tell us about your work and why patient understanding and trust are so important to you in dentistry?
Well, I'm a dental therapist. I'm actually dual qualified dental hygienist and dental therapist. And I'm also the founder of The Modern Therapist. And The Modern Therapist is a training brand dedicated to putting dental therapy back into practice. Because although dental therapy has been around since 1960, it's really still in its infancy as a profession. And it's not really until very recently that we've been able to come out into practice and really use our full skill set. And so what The Modern Therapist does, we have two arms really to the business, to the training brand. One side of it is training amazing dental therapists to be absolutely brilliant and looking at the physical treatment that we provide and the communication that we provide. And the other side of it is helping dental practices and dental corporates to integrate dental therapy within their practice in a really patient-centric way and a profitable way as well. Because dentistry is a little, or has been a little old-fashioned in a sense that it's I always describe it as one-man band. You see one dentist who does all your care. Whereas if you look at medicine, it just isn't that way. We have experts in different fields. And communication really underpins a lot of the work that I'm doing, because you can't work in a shared care model and you can't work with other professionals and also patients without having fantastic communication and protocols around communication and the care of our patients. The most frustrating thing, I believe, for myself and for other patients, when you see a healthcare professional or a dental professional, is if they don't actually know what's going on about you. They know nothing about you. They don't remember your last appointment. They don't know what you had done or what you need, and you are having to communicate that yourself and advocate for yourself. So for me, that communication piece, it, like I say, underpins everything that I'm about.
No, that's brilliant. And it does demonstrate why it matters so much for the person to feel listened to and part of a partnership with their treatment.
And in an environment where, the general public don't necessarily often know what my profession is or what we do, what a dental therapist is, we have to really go above and beyond to win over that trust. And to really demonstrate the value that we bring to the dental team. And I think when we're able to provide that level of care for our patients, it's where the magic happens.
Yeah, that's a great way of thinking about it. So when we talk about health literacy, what does that mean in a dental setting, and why does it matter so much, leading on from what you'd already said?
Well, yeah, absolutely. So it leads in really nicely. And health literacy in the dental setting is very much about what a patient understands about their condition and what they understand about the treatments that are available to them. I always think about when I first started in university. And I came, unlike most dental hygienists at the time going into university, they were going from dental nursing as a natural progression into dental hygiene and dental therapy. I came straight out of university. So I had no experience of dentistry whatsoever. I really was not even a regular attender to the dentist. I hate to admit it, but I have to be honest. And so in my first year, they were all speaking a completely different language to the one that I was speaking. Everyone was using words that I didn't understand. buccal, lingual, fissure. They were numbering the teeth, and all of these things came naturally to these dental professionals. But at that time, I was a lay person. That was a different language for me altogether. And so for me, health literacy is about really translating dentistry for patients in a way that isn't just telling them what they have to have, but giving them as much knowledge about their dental health as I have, so they can make a real informed decision about where they want to go. Ultimately, I couldn't possibly be the expert in my patient's care without knowing them properly, and they couldn't possibly make decisions without knowing themselves and the treatments that are open to them well. So a huge part of what I speak about in The Modern Therapist is that communication, not just on a spoken level, but also on a visual level. So a lot harnesses digital dentistry, a lot harnesses AI as well, image generation for patients. I'm moving away from showing them, tiny little 20p piece size handheld mirrors, where I can show them their caries or their decay or their holes in their teeth, and much more towards a bigger picture.
And that one-to-one communication allows them to ask questions, which I know they can ask AI, but the AI is going to take longer to learn them. That's something we've tailored so well, isn't it? That ability to listen and understand how much they're understanding so that we can help them. No, that's great. Thank you. So why do you think patients often struggle to understand oral health or their treatment options, even when we have explained things, well, we think we've explained things clearly?
I think it's because we don't all learn in the same way, and we have to find a way that speaks to the patient. It's that age-old thing that if there are any hygienists listening, they will remember, probably 3 or 4 or 5 times a day a patient comes in and says, "You told me to floss and I've not been flossing," So we know that communication isn't working. Telling patients what to do isn't working, and using that clinical language or using overwhelming or confusing terms for patients isn't working. And I really think that that white coat syndrome, where we're the expert, therefore you must do as we say, it's very old hat, and it's not something that I personally want to, in the way I want to work. I'm really challenging, and I'm very passionate about challenging the way that we work with patients. And the idea for me is that we need to find out what works for them. What is it that they would like to have with their teeth? And a lot of the conversations that I have with my patients in particular is, how would you like your teeth to look or be or feel in 5 years' time, in 10 years' time? And how can we work together to ensure that we achieve that? And Rhiannon, usually their answers are, I just want them to be comfortable, healthy, and it's a very basic need from a patient. I just want them to be healthy and comfortable. And so rather than looking at the right now and the panic of, oh my goodness, you've got bleeding gums, or you've got swelling, or you've got decay, I don't want to look at that with patients. What I want to do is look at, what can we do to make little tweaks to your lifestyle, to your routines, to empower you to be able to achieve your wants and needs in 5 years' time. And that doesn't mean we have to go straight in and change everything about their life straight away, but it's about showing them, well, this change will improve this part of your health outcome, and showing them the pictures, showing them the techniques, physically getting them to use the TPs, the brushes, the floss, all of the products that we all advocate for, showing them why that works for them on a personal level, rather than just saying everyone must floss, everyone must brush their teeth. It's talking about the individual, looking at what is their personalised situation and personalising care for them.
Yeah, creating a care plan with them.
That joint conversation, it goes two ways. I often say to patients, listen, I'm your safety net. I'm not here to be your cleaner. I'm not here to fix the holes in your teeth. Okay, I will do those things, but what I really want, what my big passion is to achieve patients who don't need me. And if I can achieve a patient who doesn't need me, who comes in for a checkup, we do an oral cancer exam, we review their digital scans to check that they're on the right track, that nothing is degrading, nothing is changing, and that's all they need from me, then that's my job achieved.
That's a win.
It is a win, and prevention really is at the heart of everything we do. Don't get me wrong, we all know from the modern therapist that I love a restoration and I came into dentistry because I love art. I want to be artistic, but part of that art is actually bringing patients on the journey, and getting them to the point where they come out of the surgery and they say, wow, I never understood that before. I never saw those things before. I've learnt so much about my mouth. And I think it's just knowledge sharing. I know those things about the patient's mouth. So why I've got to find a way that they will understand, that they'll be able to then take that knowledge on and apply it in their day-to-day life. And if it goes wrong, then I'm the safety net. They'll come back and they'll say, listen, I dropped the ball, and I need help. And they feel comfortable saying that as well.
That leads beautifully onto my next question about sort of trust building, because you just gave an example of where the penny drops, if I can use that analogy, where you just realise that someone could be in their 60s and they've only just realised that by cleaning every surface of every tooth every day, that it actually might prevent some of these problems. So when you have that penny drop moment, what do you think trust building kind of communication looks like just in a routine dental hygiene or dental therapy appointment?
Well, for me, it's about making every interaction feel personalised and also collaborative. So, I will never sit behind my patient at the start of the appointment. I will always sit in front of them. I will always ask them how they're doing. I will always ask them questions about their life, their lifestyle, their children, their work, their habits, their diet, their stress levels, their sleep. And I can see that patients sometimes feel a little taken aback. They've not experienced that kind of level of maybe prying conversation a little bit. But what I then do is I link every part of my appointment to the answers they've given me at the beginning. So I'm always linking, listen, I know that you said, you've got maybe three young children in primary school. Mornings are busy and stressful. Maybe we could consider, once you've dropped them at school, that's your teeth cleaning time. Or maybe we also link it into speaking about, how you could do your oral health routine with your children so that you're showing them, dad looks after his teeth, so the children also look after their teeth. I always link the conversations we're having back to their dental health. So if they mention they're very stressed and I see lots of wear facets on their teeth, we can say, listen, I heard you were very stressed. You mentioned your job is very stressful and difficult at the moment. Lots is going on. I'm also noticing a lot of wear on your teeth. You've lost a lot of the enamel. Perhaps we need to look at lowering stress levels. There are some things you can do, limiting blue screens, those kind of little tweaks that patients feel you're listening to them, you're making them feel heard. And I think trust is built when patients feel seen, rather than processed. I started my career as a dental hygienist doing 30-minute scale and polish. It was exhausting. I didn't have time. It didn't seem to matter what the patient looked like, what their health history was, what their oral hygiene was. They still got 30 minutes and they still came back in 6 months. And I don't want to process patients like that anymore. I want to work with them personally until they reach that goal of not needing me. And then it's just a case of regular check-ins rather than this cycle where nothing changes, because I don't feel like a great hygienist if nothing is changing when I'm seeing my patients and they're coming back year after year and they look the same. What am I actually achieving?
That leads on nicely because I think we've followed on from a programme where there wasn't enough time for prevention. It wasn't funded. So you got, dentistry was paid on doing dentistry, whether that was restorations, cleaning, less on the prevention. But actually it does seem now like dental hygienists, dental therapists, they have actually got more time often to spend with the patient, depending on the nature of the practice they're in. They may own their own practice. And how can they use that time? I'm thinking, giving examples again, maybe, of how can they use that time to improve understanding and build trust. You said about the beginning of the appointment. How might you sort of tackle the end of an appointment?
It really depends on what we've come across with the patient. But one of the big changes I think that the profession is making at the moment is having the power and the advocacy to be able to treatment plan appropriately for our patients. So yes, a lot of us do have more time, but that's not actually the case still for a lot of professionals. And I think one of the things that we can change, one of the things we can improve on, is having the confidence to say, right, I'm not going to complete your care in one session today. It's not possible for X, Y, and Z reasons. We need to see you back. We need to review the situation, and we need to take this further. And to be able to use that initial contact with the patient as a screening, assessment, and engagement kind of appointment. Of course, you can provide some treatment, but it doesn't necessarily mean you have to complete that. To be educating the patient enough, or to be working with the patient collaboratively enough that they understand there might be more to this situation that they're faced with, and then you are therefore empowered to be able to treatment plan for further sessions with them, to be able to bring them back and continue care in a way that means that you haven't lost all the work that you've put in the first session, because it hasn't been 6 months, means that, realistically, we are creating space, we're creating time for ourselves, and then following research guidance that shows that inflammation needs time to go down. Patients are more successful if they work at it at home, if outcomes are better, if patients are engaged. So explaining those facts and being able to get the patient back and being able to complete treatment as a dentist would, they have an exam, they make a treatment plan, and they complete the treatment, and then and only then would they have the patient back for an exam, right? So I think becoming more modern in our approach, becoming more forward thinking, and having the collaborative discussion with the patients means that we can push for more time. And one simple thing that people listening can do right now to make a big difference to giving themselves this opportunity to create time is to just put blocks in their diary for this. We've got so many people still working to that 30-minute scan and polish model, and they have so many patients absolutely stacked through their diary for months on end, and they're saying to me, well, Kat, how do I implement any changes when I've got patients coming out of my ears? And I would say just put blocks in your diary, a couple of hours every day for people who need continuing care. People who need further care, further input, and you as the clinician make those decisions on who those people are. You're the person that books them into those spaces. And obviously it's got to be appropriate and it's got to work for the practice, but I definitely think that simple step makes our workflow more efficient and much more likely to be successful. And then the best thing is you start seeing less patients who need small things because they become healthier, and you see more patients who need you desperately, and then you become more fulfilled as a clinician.
And you see them in a more timely way, which is a better service for them. Absolutely. I'm thinking with the examples you've given that sometimes we get onto that treadmill and it's because we're worried about not doing enough in an appointment. Will we be judged? If there was a complaint, for example, will they ever turn around to us and say, but you didn't do it all in the first appointment? Do you not think that the newer guidelines that support us now, like the S3 level guidelines on periodontal and implant care and caries management, that has really helped us in the sense that it allows us to keep people in that prevention stage, show their level of engagement, so that actually we are able to justify our reason for taking the time to invest in prevention.
I absolutely think that that's helpful, and I think it's wonderful that we have this sound basis of research that demonstrates how important it is that we take this stepwise approach to patients' care. However, there's a missing link between the academic and the patient.
Mm-hmm.
So we've got our research, and that's on one side. You've got the patient, and that's on the other side. And then right bang smack in the middle is the clinician. And we have to communicate this. And no one is really helping with that communication piece. What we have to do is say, this is what the guidelines are, and this is how we translate that into processes and protocols within the practice that serve you better as a patient. And I think there's a fear from a clinician point of view, like you just mentioned, Rhiannon, about a complaint or a concern. Listen, complaints only happen when there's poor communication. If you have that relationship with the patient and they've fully understood where you're coming from and they're given the option to make a choice, let's be honest, it's very important that patients have made a choice and are given that chance to do that as well. Only then, are you not going to have the concerns about complaints. I mean, I am well known in the practice for dealing with the difficult patients. And I do that firstly because I find it's a passion to be able to really work with people who are nervous or anxious or coming across as aggressive, but actually that means they're nervous or anxious or have had a bad experience in the past where they felt disrespected often, or they felt like they've been looked over. Those are the patients I'm passionate about, and it's because they just need someone to sit down, take a breath, and communicate effectively.
Yeah, and strangely, I mean, I know what you mean when people say the next patient is I never find them difficult. It's a challenge sometimes, isn't it? But actually that patient, once you've spent that time and invested it with them, they never called a difficult patient again. Actually, they just needed someone to listen to them and explain. So thinking that the next question I was going to ask was about how we can use more simple terms with our patients. So like you said, it's that gap between the academic information that we've got and the people that are writing it and then the patient. So we are that in between. So how important do you think it is that we use terminology that actually does get this across? Because it's so easy to talk the way we talked as undergraduates and postgraduates, using our terminology, but actually that is often where it gets lost then, isn't it?
It's crucially important that we are able to use both languages. And I think in our profession, there is a little undercurrent feeling that if you don't use the absolute right term, then you're sort of not professional enough. But I pride myself on cutting through all of that, all of the academia, all of the academic terms, and actually, I don't think it's necessary for us to communicate in the same, if you think about the TMJ and we think about occlusion, there are sort of 5-6 different terms for the same thing, which is how the teeth come together. And actually, I in the Modern Therapist, I try to debunk a lot of those terms, and in our courses, I try to use plain language with professionals because if you're learning something, you need to first be able to digest it before you can then attribute a academic term to it. And that's actually the same for patients as well. They need to know the principles. They need to understand what we are actually speaking about. They don't need to have the textbook terms for periodontology, periodontitis. They actually need to understand that their gums are swollen and it's giving rise to bone loss. And if they lose their bones, they will maybe eventually lose their teeth. It's that simple. And if we can simplify things for patients and it'll improve their understanding, more to the point, if we just speak to each other in simple terms, in a professional basis, we would speed things up. We would speed up communication so much quicker, so much easier. We use digital scans, digital photographs, we use all the tools available to us. Actually, communication becomes much easier, and much less misunderstandings will occur as well.
And I think the patients, they obviously, it is a business, they are paying mostly for a service, but actually that part of that value of the appointment is us being able to take the high level academic evidence and transfer it into language that's understandable for them. And then when they're making a decision about the care plan we've created, we can talk about the strength of evidence and whether it would work for them. So I think it's really important that we are that in between, like you were saying, between the academic level stuff and what the patient can understand.
And it's not just translating the language, Rhiannon, and you said something really powerful just then. It's whether it will work for them. And that human element about whether a patient actually will benefit from treatment. If we look at them as a human being, if we look at them as a whole, will you benefit from this right now? And there will be patients that come in for checkups with me, and they have lots of early carious lesions, and their oral hygiene is very poor. And then I'll have another patient, the next one, a few early carious lesions, and oral hygiene is pretty good. And those early carious lesions, I wouldn't necessarily recommend the same treatment for both patients, because they're both managing their health in different ways. So yes, we can translate the terms, and we can give them all the advice and all the information, but we also need to be able to look at the human being sat in front of us and know whether that human being would benefit from what the academia is saying is best.
Because you said something that I found interesting earlier about patients who have maybe not been listened to effectively, or felt very dismissed, because that when we talk about communication and explaining things, I always worry that I might sound patronising towards the patient. Do you have any advice? Because I'm thinking some of our listeners will be graduates, they're quite new to this. They've had lots of time at university. Now they've got shorter appointment times. They are autonomous now as a clinician. It's how we manage that communication without actually sounding patronising, which is a balance, isn't it?
Actually, what I always try to employ is asking the patient a question first. So, would you mind showing me how you brush your teeth? Would you mind showing me what your technique is? And then if there's anything I can help you with in terms of small tweaks or changes that might improve things, we can go through it. I'm not saying they're wrong. I'm not saying I already know that they're doing a bad job. I'm asking them to show me what they're doing. And often they're not doing a bad job. Often they're doing something I wouldn't have even imagined, like barely touching the teeth with the bristles, right? This is one of the big ones I notice is patients who have been told off in the past. If they've been told off for overdoing things, then they go the complete opposite. And you watch them and you think, this makes sense now. I can see why we have lots and lots of problems all of a sudden. Or, investigating their diet, for instance. If I ask patients, especially where I work in the financial districts of central London, so there's lots of fizzy water and there's lots of fruit. And explain to patients that I'm going to ask about your diet, but I'm not interested in how much you eat. I'm interested in what you have and how many times you have it, and I explain why. Once you give them the explanation, they start making the connection, and they start telling you what happens with them. And I'm not going to lecture them until I know for sure what it is that's going on with their personal situation, and then it's not patronising.
Oh, I think any clinician we couldn't go a whole week without a patient coming in and saying, you're going to tell me off. Hopefully someone I've never seen before, because they should know I'll never tell them off, but we hear it regularly. That is what they expect, isn't it? But that means it's changing that idea of who we are and what we're there for, and it's a partnership with them, and our goal is health. I want you to be healthy. Like you said earlier, I don't want you to need me other than that safety net and support. No, that's great advice. So I'm thinking about how we can sort of giving sort of balanced information to help them feel empowered, but without overwhelming them. It's that, and what resources are out there as well.
Yeah, I think definitely empowering our patients is the key, right? So I always think of it as sort of building a journey. And when I do a checkup with a patient, I say, listen, what we're going to do is fact-finding mission today. We're going to find out what's happening at this snapshot in time with your teeth. And then and I always sort of like break things up into, if there's things that we urgently need to address, I will speak about those first. If there's things that we can see are happening to your teeth and there's ways that we can prevent them, then we will look at that as well. And then we'll have some blue sky thinking about what we could do going forwards or in the future to really support the long-term oral health. And this is really where clinical judgment meets communication, right? So you have to be able to know, what does that patient need right now to make sure that they don't deteriorate between now and the time I see them again, and then what's coming. And we don't need to give them or make them do everything in one go. Yes, I want to do whole mouth treatment planning, and yes, I want to talk to them about everything I see. It's really important to me that they go away with a full understanding, but I also break that down for them and say, these things are not scary, they're just things that we need to look at in the future, be aware of, be mindful that might come up soon. And then there are, like I say, blue sky thinking things that are treatments that would potentially support a much longer, healthier dental health for you going forwards. And this is where, again, being modern, using digital scans, using photographs, sending the patient away with those things as well, visual reminders, and written into urgent care, stabilization phase. I usually do like off to see the dentist for orthodontics or splints or, some kind of care that will, manage occlusion, because occlusion is a big problem where I work. And then, further in investing further care into the patient in future with maybe restoring wear, restoring aesthetics, restoring function with implants, those kind of things. That's in your blue sky thinking.
And thankfully we teach that way now at undergraduate level. When you're creating that treatment or care plan, we stage it. So it actually does seem it's more manageable for us. And maybe you don't move to the next stage if the first stage, so if they're not making reasonable adjustments to their diet, they're still high risk. But it seems more manageable for both us and them, doesn't it, having it that way?
And it completely speaks to the shared chem way of working as well, because dental therapists can take on that stabilization phase. So your patient doesn't necessarily graduate from the shared care phase, from the stabilization phase with the therapist, until they've improved those parameters at home. And then that blue sky thinking is often the bit the patient comes in asking for. So we're able to say, right, well, if we want to achieve that, here's the ladder, here's what the rungs we need to take to get you to that point. And that really fits so nicely for a dental therapist. We have the skills for communication, we have the skills for stabilization. We work so well with other members of our team, with dental hygienists, dental nurses. Now the NHS is bringing in so much more collaborative care with team members. It's so exciting to be able to see that we can now work really effectively with our dental nurse colleagues as well, in providing prevention. That now you're looking at a future, and this is why at the very beginning I was saying we're in such an infantile state in our profession. We're so early on, because it's only very recently we've been given the liberty to be able to showcase our skills effectively, with exemption rights and with NHS courses of treatment, going back to direct access coming in. Those changes have all needed to happen to get us to the point where we're now becoming a modern profession.
And that work is ongoing. So your professional organisations thankfully have a seat at the table. But it's really important that I, representing dental hygienists and dental therapists in my position, have these conversations so that when I am the only seat at that table, I'm not just speaking from my own personal experience. It's really important that we know the experiences other people are having. So no, that's great. Thank you for that advice. So I have one final question for you, Kat, please. And I'm thinking, for anyone who's a clinician who's listening today, do you have just one piece of advice that you think they could go to work next week and communicate differently to their patients? What one thing would you recommend that could make a really big difference for their communication?
To work in a modern therapy way, it is about not just treating mouths, but treating people. So spending more time listening and less time speaking, maybe.
2 ears, 1 mouth, yeah, is a clue.
Shift your clinical from delivering information to really tailoring your conversations to fit with your patient. Understand who the person is before you look at their teeth and before you look at their mouth, because ultimately those teeth and the mouth fits in to a wider picture, which is the patient. And I always say to my patients, and I reassure them that I know teeth may not be the highest point on their scale of things that are important to them, but I know they're important enough to get the patient to sit in my chair, and for that reason I'm going to give it my all, but I'm going to give it in a way that makes sense to that person. So yes, one thing to change would be make it personal.
Brilliant. Thank you so much for your time today, Kat, and your insight as well. I know we know each other anyway, and we get to talk to each other about lots of topics, but I think you'll have inspired people, because I think sometimes people can be too scared to move away from what's seen as the way we've always done it. And actually it is that it's exciting to think you can move away. You know what your scope is, you know what your abilities are, you can become a modern clinician and make these appointments work for you and more importantly, the patient. So no, I really appreciate your thoughts today.
Thank you so much for having me. And if I can inspire one therapist or hygienist to move from having 30-minute scale and polish to having a varied and interesting diary, then I feel like I've done my job. So thank you so much for letting me.
You will have. Thank you. Take care. Bye-bye.
In healthcare, precision matters. That's why clinicians across the UK trust Admatec. Since 2006, Admatec has been designing and crafting custom-fitted magnifying loupes and advanced headlights, helping clinicians see clearly, work comfortably and perform at their best. Lightweight, ergonomic, effortless to use. And with the Flamingo integrated camera and headlight system, you can capture and share your work with exceptional clarity, supporting education, collaboration and patient communication. So you can stay focused on your patients while Admatec focuses on you. Trusted for nearly 2 decades, Admatec's precision optics support clinicians across a wide range of procedures, enhancing clarity, posture and performance every day. With a dedicated UK office, faster delivery and local support, expert care is always within reach. Admatec UK. Precision, comfort, clarity. We've got your back. Visit uk.admatec.com to learn more.
That brings us to the end of today's episode of Dental Health Matters. Thank you so much for listening. We hope you found today's conversation helpful and informative. If you enjoyed this episode, please remember to subscribe, leave a review or share with someone you know might benefit. See you next time.